to the series of case presentations on interprofessional practice and team-based care that are being produced for learning for students in the College of Health Sciences. I'm Sarila Ramklas, and I'm from the School of Clinical Medicine, and I'm joined in the studio today by a team of lecturers from the disciplines within the College of Health Sciences who will describe their role and in their profession in the assessment of a patient diagnosed with TB meningitis. So, as you watch this presentation, please pay attention to the scope of practice of each healthcare professional and recognize the value that each profession brings to the assessment of this child. And so let me then present the case. An 11-year-old Calvin John was admitted to a tertiary level public sector hospital in KwaZulu-Natal 3 weeks ago, presenting with headaches, fever, decreased level of consciousness with a Glasgow Coma scale of 12, vomiting, loss of weight, inability to walk, visual impairment, difficulty swallowing, and discharge from both ears. On admission, the patient was assessed by a nurse in the pediatrics outpatient department. The values for Calvin's height and weight were communicated by his mother. His height was 141 centimeters and his weight 21.3 kilograms.
A series of health professionals will actually see this child. So we'll actually tell them what will be taking place. But prior to that, you will also, before you can refer this patient to anyone, you can do your own assessment as a nurse. So the first thing is that you do full history taking. After full history taking, then you will also do your vital signs.
Thank you. I think as the nurse told us, there's lots of valuable information that she would have assessed. But I think the main role of the pediatrician is the initial coordination of the assessment, the initial assessment and the coordination thereof.
Okay, the speech therapist did send the information on what the speech therapist will do in this case. She indicated that the role of the speech and language pathologist will be, with this client, would be to assess oral motor sensory function of the patient, to assess the swallowing mechanism, obviously the oropharyngeal mechanism, and to assess for safety in swallowing.
All right, so when we called in to see particularly a child, our major concern, honestly, is the nutritional risk. Okay, so when we get called in as a dietitian, first I do two things really. I look at the nutritional risk for refeed.
So the management will depend on the specialist, that's in charge, and how the specialist will want to start with the treatment. So depending on the medicines that will be prescribed or or suggested or recommended, if I can use those words, the pharmacist will have to be the person looking for those medicines.
Okay, so from our side as a specialist dealing primarily with just hydrocephalus, which is our link with the pediatrician, the consult would come after the CT scan has been done, because the CT scan, based whether the radiologist reports on it, which is the ideal situation. So the radiologist would report whether there's hydrocephalus, and they can distinguish whether it's communicating or obstructive. And basically what that means is if it's obstructive, that the flow of CSF is obstructed, so LP would be contraindicated in that situation. That can put the child at a risk of herniating and coning.
I think in this instance we have to look at the process that we would follow in terms of the assessment. Because with occupational therapy we focus mainly on the function of the child, so it would be imperative to determine the level of function prior to admission, because that sort of gives us a baseline as to what are we working towards.
Thank you. This is a very interesting case. For me as a physio, when I look at this child, firstly, it's an 11-year-old that is unable to walk. That is a huge concern for a physio. All of that's where you would want to find out when did this child stop walking.
All right, so if the child is coming in already with discharge, we work very closely with the ear, nose and throat specialists, and we would need to refer them to have the infection managed by the ear, nose and throat specialist.
Actually, with this patient being in hospital with presenting with so many different things, we're going to have to be very selective. So I think we'd start off mainly with the first battery of tests. We're checking the vision and how much the child can actually see.
Amongst ourselves, we've learned so much today. So I can only imagine that this must be a great learning for students who are going out there and in practice. I want to thank you all for making the time, and I want to just leave with one comment to say that no one person can treat a patient alone. It needs a team-based approach, and let's promote it. Thank you very much.